We have improved from a 45% leakage down to 26% as of last month.
Welcome to Unjargoned, a podcast about healthcare workflows that make sense and without all the acronyms. We talk to people on the front lines of healthcare and explore cool solutions they're using to solve real problems. I'm Angie, product manager here at Luma Health. I own all things Access, Fax Transform, everything under that umbrella.
Hey, everybody, I'm Dave Smith. I'm a revenue leader here at Luma. I live all things Access as a type 1 diabetic, so I see the lens of these workflows very personally and always excited to dig in and understand how healthcare is becoming easier for the nexus of patients and providers, and that's what Unjargoned really brings to our audience.
And today, we're heading to Blackfoot, Idaho, population 12,000, and home to Bingham Memorial that's seriously punching above its weight. And today's guest is Zac. We're so excited to have you. He's one of those people who doesn't just talk about operations, he actually lives it. He spans marketing, provider optimization, clinic administration, which means he sees the full picture. He's constantly translating between strategy and execution and making sure things just don't sound good, but actually work. So welcome to the show, Zac Rice.
Thanks for having me, everybody. Look forward to this.
Yeah, you don't realize what you signed up for. So get ready.
We'll be good.
We're thrilled, Zac. We're thrilled.
Excellent.
I feel like you have so much experience spanning from like receptionist to sleep center, all of this. Like, how do you think all of that experience maps up to the work that you do today and why it's helpful?
To understand the workflow is very important as far as being able to capture data, because the easier something is to do, the more likely that is going to be how something is entered into a system. If we make the entrance of data into the fields that we want to capture easy for a front office or a back office person, they're more likely to complete it. So rather than making the shortcuts into data entry as far as patient care goes, cumbersome, click here, click this, click that creates shortcuts, so people will start using something different where there's a free text field, or they will, rather than click in a couple boxes, they will click on their last save thing and enter it in there, or they'll go to the familiar and they'll start doing things, or it will just be empty. You'll just have blank information. So by understanding what processes they currently have to do in order to put it in correctly, you start to get a understanding for why that data is not pure. It's not bad data. Data is data. It's just not pure. It's not clean. And so being able to be in that back office, front office role allows you to understand what's happening. So even as a manager, would have to every once in a while cover back office at an urgent care. I've rinsed eardrums out and different things like that. But the documentation process of that can be cumbersome, especially if you're a slow typer like myself. So I actually used Dragon a lot, and I guess we're moving away from that. We're moving more to Suki now. But I use Dragon to track mouse cursors, and actually I would say something to the terms of leaky faucet, and that would be, it would help document a urinary tract infection, something, or an STD check or something. I would make up different words to be able to document everything we needed to be able to bill it, but also everything that somebody needed to do as far as document the care and would get charge capture out of it. But it created a workflow that made ease for our providers and a few explorative back office staff that were willing to make their job easier. So
I feel like we say this
maybe
all
a
the
little
time
bit too
too.
much.
We're only as good as the data that we get from y'all, and like we're doing the work from that data. So I feel like having that like credibility in the data that's coming in, I feel like that makes us better too, and better partners that we can work together. I feel like we're talking so much about metrics. This is more out of curiosity because you're probably looking at all these different facets across the system. But if you had like your main North Star metric that you are always looking out for, what is that? And maybe some secondary metrics that kind of bubble up into that North Star.
Well, that's really hard to narrow down to one. That's really, really hard. From a marketing perspective, definitely patient satisfaction is one of them. We do a fair amount of feedback and reputation gathering, as well as surveys through broadcasts and campaigns. So that's very important to Bingham. What our patients think about us is more important than the data in the background, because your data can be really clean. But if they don't think they're getting the care that they want and the outcomes that they need, then you're not, the data doesn't matter anymore,
Mhm.
because eventually that data is going to start going downward in any trend, whether it's referrals or visits or bottom line dollars. It's just so. Number one is probably going to be patient satisfaction, which Luma has helped us gather the data to see what we're doing. We've created uh, a couple custom feedbacks. I've got access to your snowflake in the background, and I'm actually making service recovery dashboard through Power Apps using your Snowflake tie-in with a query. So I pull it into Power BI, then using that, I'm working with one of our other geniuses, Nathan Scholes with Bingham, and we're going to make a Power App to see whether issues are resolved when we get a poor feedback. So when someone answers 7 or below, we will say whether it's resolved or needs escalated. There's so much you guys do that my mind initially, I was with a previous vendor and I had built a lot with them. And it was painful to be asked to evaluate another platform for sending reminders and recalls when I had just built out this whole platform with custom flows so that we could get them to Google and so that they could text in, but they never could call in. They could never do a navigator, but the texting was not AI, it was AZAC, as far as trying to think what the workflow would be and trying to figure those things out. So it was not as mechanical learning as what we have the option of using now.
So, Zach, I'm curious if you could take us back and maybe share with us a little bit of how you lead the competitiveness in your market. And the last thing, if you can, weave in there for us, is I think we heard that there's a great mantra. If world-class healthcare can grow from a cornfield in Minnesota, why not a potato field in Idaho? And so I'd love for you to just take a minute or two and zoom backwards with your marketing head, with that influence, and tell us how you leverage that way of thinking to compete and win in a competitive market like you are.
Well, I was a college wrestler, so I'm competitive in all things, even if it's, hot pepper eating. When it regards to medical, I did get to be a patient as an athlete. So I saw how they competed and they made organizational relationships with the college and the athletes. And I think we have taken some of that even way before I was with Bingham. Bingham has done a really good job. We are a rural hospital, but we are very much a surgical rural hospital. We have 17 outlying facilities across 3 different cities. We pull from everywhere, but we also have a highly competitive environment. We have 3 different hospitals, 2 in Idaho Falls and 1 in Pocatello, that they could go to locally in Pocatello, but I think people are willing to drive to Blackfoot for their procedures based off of what we've been able to do competitively by opening up access is one of the biggest things. Is where we're moving towards, and is one of the biggest reasons we've chosen to partner, is to be able to get people on the schedule, to cut out the middleman, to open it up to different times, the times that don't fit in banking hours, fit in mother hours, when they're not running around doing everything for their family, and when we're not working at our jobs. So I think looking back on all of my experience with marketing, access is everything. We have at Bingham, we call it the gown. It's just a medical gown and it's framed, and it has to do with, patients being first. We exist for them. We're here for representing our patients, and we also do something called the mother test, like, how would you do this as it pertains to your mother?
So we understand your definition of access in a competitive market. Where does it start and where does it stop?
Access. Access starts with the patient's perspective. So access starts at the level of in which somebody needs to get into you. Personal interaction is where it starts, but it goes to the comfort level of whomever is receiving that care. Somebody who doesn't like that personal interaction, access is a click of a button on a website. Access is seeing an ad and being able to click onto that. Access is very different for every individual patient and every individual person. But to me, access is granting all fields to be available, and also access is getting into the specialty that you want.
We'd love to hear, Zach, a little bit of what you have discovered and innovated as it relates to paper associated with referrals and how you've discovered a workflow solution that I think is delivering exceptional results. Everyone's always looking for a better way to take paper that's a referral and make it an order, but see it through to a completed appointment.
So the internal paper to data, as far as our providers putting in referrals from us to ourselves or us to others, that portion of it we have troubleshooted the best, and that's where we have the most amount of data. When I initially started diving into Meditech's background, we were able to tie into ARM and pull reports from the clinical order into the ARM order. So because they flow from one to the other within those two workplaces within Meditech. So we were able to start being able to track referral orders because it's a specific type with specific patient information, and then start delegating whether they were internal or external orders. So we focused on the leakage, we call it, our providers that are sending services that we can do in system to external systems, basically our competitions. And then tracking that, figuring out why that is. Because sometimes it's as simple as we hired this new back office staff and they don't know that we have a neurologist. So as a marketing team, we will go and teach them that we have the neurologist. But we have improved from a 45% leakage down to 26% as of last month. And that may become the flat line because there's always patient choice involved with where you go for your care. But what we're doing for advancement, talking to Angie, we're really working hard with Fax Transform and making it super special, indexing things and making it so that the patient's provider can see those as soon as it is indexed via operational AI, and then the provider can sign off on it, their work group can work on it. But once we get more into the optimization phase, I want to use the paper referrals that are coming inside and transform that data in some way that we can get to discrete fields to where I can measure it, put it back into ARM. And then we already have the referrals process started, right? We've got an SFTP started, and there's some file sharing that we're testing out to where it goes into ARM. They put it into ready to schedule status. And then those patients that like to schedule off of text messages, they receive a text message with a link that says, "Hey, Dave, looks like Dr. Rice ordered you a mammogram. Would you like to click here to schedule?" Boom, right? Now, they're not going to have a mammogram, but I did walk through that. Pretty funny.
Zach, I've been doing some research on this, working on some other projects on the side for Illuma, and I found that I'm opening up my research here, 90% of healthcare executives lack confidence in the visibility into referral leakage and the referral end to end, given that faxes tend to be a black box. And so what does having all of this data and being able to see everything end to end really mean for your organization?
Financially, from the first quarter that we moved to the second quarter, there was an increase of 225 or $2,250,000 in billables. That's what we billed from first quarter 2024 till first quarter 2025. We started with an internal count of around 763 internal referrals per month. As of last month, which is our highest ever internal referral count, there's 1,149. So per month. So we have increased over 300, well, almost 400 internal referrals, and they're trackable now. So it's definitely had a bottom line impact because I'm only tracking surgical revenue. But further than revenue, it really creates a better patient care model for us at Bingham because we can close the loop on all of those referrals. So for a hospital, for a rural hospital to be able to close the loop, track that through, make sure that your patients are being followed up with, see each and every note that's done because it was kept within within the organization. I think it's created better care. I think we're top of the line care, which makes it easier for me to market for us. But I think that's one of the bigger things that maybe not as measurable is the outcomes. I think it's created more patient outcomes, but from a data perspective, it does the typical things that you want to happen: better revenue, less leakage. And I think it really has created a more knowledgeable staff to what our organization is actually involved in. So we don't have that, oh, Dr. So and so didn't even know we had a neurologist anymore, because at the end of each month, I have the top leakage. It goes from the people who have the highest percentage of external referrals down to the lowest percentage of referrals. I just rank them, and then I send an email out, and then you can drill in to see what we're leaking. And sometimes it's as simple as they don't know you have it, and sometimes there's a service line recovery that we need to explore. I always have trouble with this receptionist getting them in, so we go do some intervention, and we fix the service line up, and more normally we get to the bottom of the problem, and we still have a good employee that's happier because they understand what the goal is of Bingham, to have excellent health care and provide and be the most trusted organization in the area.
Zach, really, really quickly, if I'm just doing simple math in my head. So you started around 700, you're now at 1100, but at 1100, you're actually catching 75% now that are getting completed of that referral. I would have to think that that is close to 8 figures and quarterly or annualized contribution that you've been able to make.
We've been able to track. As far as receivables, what's hard with the data is because we've cleaned up the process, now we catch more data. This is my data science behind it. As far as what it's
Well,
has
Zach,
it
hold on real quick. You're super humble. Okay.
Well, I had to be talked to by Mark about this too. As far as, yeah, I just, for me, yes, it's about $2 million, $2.5 million in just the surgical per quarter. As per
Next,
quarter,
yep. Next question for you, just real quick. How will it be reinvested so that your patients are receiving new innovation? Do you have any thoughts
Also,
on that?
sorry, like millions of dollars per quarter. I feel like we can't let that go. Like, that is such a mic drop. I feel like we're being way too humble about this and like jumping ahead. Like, that's pretty crazy. And then
millions of
back to
dollars
Dave's
in
question.
charges.
Yeah,
Charges. I don't know what we collect on it. I don't have that.
still,
I don't go down to it.
that's amazing. And so I guess back to Dave's question, like, sorry, what does that mean?
Well, because we're a rural hospital and we're not a not for profit, we're a not for profit hospital. I see what Bingham does with our money. We put it back into technology. We put it back, we put it into Luma. We've got the best mammogram in the area. We've got the newest MRI in the area, the most open spaced MRI in the area with the best images. So, and we've got a new Mako robot for surgical shoulders. I mean, we really put back into our patients, really, because that's who receives the care at the end of the day. It back into delivering great patient care. I mean, there's big plans. So I know we'll continue to expand access through locations as well as through digital intakes, through self-scheduling. I I see them as putting it back into our organization. We do a we do a we do a whole lot of innovative things, from the potato farm and growing into that, state of the art care. And I'm happy to be with Bingham because of that. It makes it easy to work for an organization that does that puts back into their people. I mean, they've given me a lot of opportunities to grow. Before I joined Bingham, I didn't know how to do Excel, and now I do SQL coding, and I'm in Snowflake, and we do, I'm in Power BI designing things, and got a new guy that they just hired that does just Python coding, and now we can scrape data, and we're pulling all sorts of stuff in there. They really invest in their people as well as their facilities, and I think that's what Bingham will do with any extra revenue, if we want to call it extra revenue, captured
Zac,
revenue.
Zac, I think for the audience's benefit, this verticalized referral process is often overlooked. Most of our customers are trying to take and compete on external referrals coming in because that's such a huge pronounced problem. So, but they over assume that because somebody is already their patient, that they're going to then get their care there. Okay. And so let me just summarize what I think you shared a little
It's a
bit.
scary assumption. MGMA data says 55 to 50% is what the average healthcare system leaks
I
from
don't
their own
disagree. Like,
providers.
we see the same, by the way, it's oftentimes picking the fire to put out. Okay. I think there's acknowledgement of this, but essentially what you have designed here is you're inserting better automation and AI at the point in which the documentation hits. And then you're incepting that document based on the integration ability of Meditech and Luma to be able to do outreach to the patient well before. So they perceive that outreach as being very familiar, being very timely, and you're not just relying on a portal or an access center to call them. And as a result, because of that inception, you've been able to go from 700 to 1,100, and you're now catching $2.5 million a quarter. Did I summarize that properly? You can say yes.
Yes.
Okay. My next question, just on this theme, is I also know you're thinking about agentic voice and how to
Yes.
leverage outbound agentic voice. And could you tell us a little bit where you see that having big impact and why?
I think two of the biggest impacts we'll have with outbound is through the recalls and referrals process. So using the agentic AI as a true operational agent to get people onto the schedule when they're due for their basic health screenings. So um, when Angie has her annual wellness exam that's due, not only can she receive a text message to remind herself to schedule, but possibly get the phone call first from the agentic AI. If that doesn't answer, then we'll send up, say, "Hey, Angie, this was Betty at Bingham." That's kind of what I'm posing is, "This is Betty at Bingham. We were looking forward to seeing you for your annual wellness exam. If you'd like to have a conversation with me and get on the schedule, you can call here or you can click this link to schedule." That way they can talk to our agentic operational AI and get on the schedule, or they can just click on the link for their text message and get on the schedule the way they want. But really lead them down to the easiest path into our system. I can't remember the metric, but we take somewhere between 40 and 60,000 phone calls a month, and we don't have a huge staff. So, that agentic AI is not only going to make it easier for those who absolutely necessarily have to speak to Dave to get on the schedule, because right now, if you want to get on the schedule, that's how you get on the schedule. Unless you have a port with our links and everything else that Luma has, that's becoming more accessible. But agentic AI with outreach for your health screenings, your mammograms, your referral processes. So
Mhm.
using that kind of custom form that we create within Luma with the link to schedule, I want I picture the agentic AI being able to take that Luma form, transform it, and machine learn from that even more adequately than what I can write in a form to get people on the schedule when they either call in or receive a phone call from their referral. So if I could dreaming big here, as a referral is processed by a referral center or from one of our back office staff, and they put that into a ready to schedule status, use that SFTP transfer, get that into the system to where Betty from Bingham calls Angie to remind her of her upcoming things that are due.
If you could go back and have sent yourself an email that had 3 bullets, and it was from you in the future saying, hey, Zac, this is from Zac. Okay. What would you say to yourself? What would be the 3 things that you would tell yourself to tell you to describe where you're going to be?
Again, I still like that personal connection. So your staff they have followed through more than any other organization that we partnered through in the past. Your ability to pivot, you're very adaptive. When I hear of updates, normally my head goes, okay, so when is this update? It's happening in 8 months, a year from now, we're going to do this. Luma turns things around on the next week sometimes. I mean, sometimes your coding and your changes to the system are so amazingly quick that would be something I would focus on to Zac Rice pre-Luma. Secondary is I would go to I would go to what it already had in store, like what they already have and how much it's different from working in the other systems in the past. It's adaptability there, the system's adaptability. So not only do you have the people at Luma's adaptability to make their system do things, but you have the system itself's own AI adaptability to make things better for the system. Third, I would say access. Luma provides a fair amount of reporting on their own. So access to the reporting data that way, but also, having some partner to work with that will give me access to another SQL server, basically, to create Snowflake and a tie to my existing data sharing platform so that our goal is to try and get everything into one place for all reporting. So even though Luma has this great dashboard, I want to push data to our people who make decisions, not rely on them to go fetch it. So Luma has given us access to data. Luma has given us access to things that we didn't have in the past. Some of the custom views that Luma has really encompasses some of the data that I wanted. Sequencing of messages, all sorts of stuff. Probably be a longer email to myself. It'd be 3 bullet points with explanations behind it on why you would want to do this. And it's been functionally easier for me to make adjustments on the fly. Some things in the past with different vendors, changing a facility phone number to the correct one to be presented to them, it comes from a 1-800 number, but when it does, it doesn't need to display as a 1-800 number on their phone. Nothing in our organization is a 1-800 number, but I'm just trying to give you an example. This provider was listed as this, but now they're this as a phone number. Those would be the 3 things. So the people, the platform, and the data. That's what I would focus on. People first, because if you have a great platform, but your people are all rude and just they're not knowledgeable and they can't get through the access of what you need, then your platform could fly. It could make gold bars for whoever it is you're partnered with. But if the people can't help you do that, then the platform doesn't matter. So people first is where I go. Platform, and then data. Data just lets you know that what you're doing is actually working. So,
Thank you. Ange?
I mean, shout out Garrett again. I feel like he's definitely a great partner in helping you set all of this up. I tell him all the time based on our conversations.
I made sure I had him when Spyro when Spyro set up that little meeting with him, I'm like, okay, this guy talks. This guy knows what he's talking about. He's answering my questions. He's never saying no. And if he does say no, no happens after he's done everything to see if he can get a yes. Right. There's some cool functionality that, from my perspective, I really want, that I've seen you guys use in the background as far as uploading, downloading for mass changes. But he at least looked at it and see if it's something I could access. But he came back with a no. But he at least went there. So
Yes.
Garrett's great.
He's the best. And I think I'm still laughing because it's like you can have all the data integrity in the world, but if the data's bad, what is that going to do? Like you have bad satisfaction, or even here, you might have all the right number of people, but what if they're not supporting you in the right way? So I kind of wanted to bring it back home to like the Blackfoot community. Like, how does the Blackfoot community kind of shape the way that Bingham has to operate?
Well, we're innovative, so we're really moving towards being the offering our patients what other people don't, whether it's the Mako, whether it's online scheduling, whether it's text message scheduling, whether it's an operational AI bot that you can call in and have a conversation with and get on the schedule, or refill your meds, or look at your referral, or there's a number of different ways. And I think we're really looking at trying to capitalize on all of the access measures there. But Bingham focuses on innovation. They really do, whether it's access healthcare as far as their imaging or their surgical department, what they're available there. And then we do a great job at hiring accessible, cool doctors. We really do. We have doctors that are outside of the box thinkers, and most of them have been really adaptable to. I mean, if you would have tried to get me to do text message scheduling on my, early practice, they've adapted since we've been with Bingham. But to text message, to get on there without talking to us and getting the records and getting these sort of things, it would have been a harsh no. And Bingham's really, their providers have been really flexible and helping and understanding that, things aren't going to be right away, but we can work with this. We can change it. We can make a new appointment type. We can do these sort of things.
I love that. Wait, any last burning questions, Dave, before I go in hot with the rapid fire?
No, bring the rapid fire.
Okay, let's start related to our conversation. What's the most underrated job in a hospital?
Underrated job in the hospital is the front office desk.
And if you were doing anything else, maybe outside of healthcare, what would you be doing instead?
Gosh, my mind is so wrapped around it right now. I don't know. I would probably go back to my more artistic roots. If we were going to relive a life, I would continue being a tattoo artist.
Nice. We should have talked about that. And then lastly, what's your go-to karaoke song?
I really suck at karaoke, so probably Baby Got Back. So
Also, what was your ringtone sound, just for science?
X-Men.
we were
97.
listening
It
to
depends on
jingle.
who's calling. I've got The Empire Strikes Back.
Is that Mark?
Who was that for? Just kidding, about to say.
Other than that, the person who it is, they're well aware it happens. And that's Emily, the PSO manager. She has to play bad guy, so I put that on there. Then my friend, when he calls, it says, "Do you want to hide a body?" It's kind of it's an outtake on the Frozen song. "You want to build a snowman? Will you help me hide a body?" So, because your best friend you'll hide a body for. So that's why his
true.
ringtone's that, when my son is calling, my son is calling. It says my son is
That's
calling. So I've got visual ringtones for all sorts of different people. And depending on the ringtone, sometimes I'll pick up more than others. So.
I love it.
Angie, what would my ringtone be for you?
I don't know. Yeah. Probably just F-bombs.
Yeah, I would think so.
Just a loud
just
F.
Yes. Everyone would look around. What?
It'd be funny each time.
Yeah. Zac, what would be the unofficial mascot for Bingham?
And can't be a potato.
Yeah, no potato.
Mascots are hard because there's so many that are already taken that seem reasonable. But I wish an old coworker were here to explain this. But he was asked this job in a job interview. What animal would you be? And I think he said a beaver, based off of their ability to build something that needs to hold up to the water and keep you warm. So I think a beaver would be pretty cool, the Bingham beaver,
That's pretty sick.
because it's an animal that can survive harsh winters. It makes its own den and takes care of an entire family. I think the Bingham beaver would make sense. Plus, it kind of rolls off there as a marketing tool. You know.
And then did you answer what your walk-up song would be at a healthcare conference?
A walk-up song at a healthcare conference. When a Man Comes Around by Johnny Cash. I came out to that once in a fight.
Wow. You went deep there.
Yeah,
Yeah.
I think that'd be
Solid.
fun.
Beaver's funny because we had this activity where we asked Slackbot what we would be based on all of our conversations in Slack. And I got beaver, but I was like, I want a cuter animal. And then it gave me an otter afterwards instead. So it's just funny. But I'm like, conceptually, yes, like a beaver's hardcore, gets work done, etc.
Yeah. Amazing. Well, listen, this has been exceptional, Zac. Thank you so much. This is littered with just really practical advice. I knew that when we met you in New Orleans. And wow, from December to now to produce that kind of multi-7-figure outcome in such a short amount of time and doing it with such a welcoming, innovative attitude for the benefit of your patients. You're just a fantastic operator, and we're really lucky. Thank you so much for joining us.
Well, I like to call out my whole team at Bingham, because everything we do, from the dashboards I make to the text messages we send out to the incoming referrals,
Yep.
really, I wouldn't be able to do this without a great operational team. Jason Orman leading our structures, to Carrie working with everything in Fax Transform, to our revenue gals that are tying in the faxes to indexing, and then and really working on making it operational for charge capture. Our PSO managers, they've adopted, because if we got Luma and we didn't have a good team that was able to reach out, I could only teach so many front office desks something, but our managers have done a great job of creating operational buy-in from a facility. So everything we do is really a family and team-oriented workflow. Not every family member gets along, but we can when we have to work together, right? So
Yes, this is like Angie and I.
Yeah, sounds
Okay.
like.
I love her. She hates me. It's great.
No,
Zac,
it's not.
thank you. Thank you for all the wisdom. We're super lucky. Go watch the Kurt Schmidt episode on Phelps. He talks about smoke meats. We talk about rock and roll, and we talk about competing and winning in Nebraska. So that's a great one. But thank you so much, Zac. You're awesome.
So much.
thank you. Appreciate it, guys.
Y'all have a
Talk
great
soon.
day.
Talk to you later.
Bye.